Good afternoon, and welcome to our Oak Bend Medical Center Happy Hour podcast. My name is Donna, and I am your host. Today, we have a very special guest, and we'll be talking about mental health. Since 2003, Sheena Ureste has been responsible for the management of Texana's Behavioral Healthcare Services Division, including its outpatient clinics, crisis services, pharmacy, and consumer benefits. Her previous experience includes service as the Chief Financial Officer for Datar Regional Healthcare System in Victoria, Texas, and Victoria Regional Medical Center, also in Victoria. Ms. Ureste holds a BBA in accounting from Texas A&M University. Welcome. We're glad to have you today.
Thank you. I'm glad to be here.
We at Oak Bend work with Texana all the time, and y'all are good with us to take care of our mental health patients. But I really want the community to understand what it is Texana does, and then I know we're only going to touch on the mental health part of it today, that y'all do so much more than that, and we will have more on it in the future. But today we're going to focus on the mental health, because with COVID and everything else, we're seeing even more mental health now than we ever have. So, Ms. Ureste, can you tell me about Texana and what are the services you offer in this realm?
Yes, I'd love to. So as you said, I'm the Director of Behavioral Healthcare Services, and in my area of responsibility, I oversee the mental health. We also use the term behavioral health services. So Texana is kind of like the safety net provider. So we are here for you regardless of whether or not you have income or the payer source for services. We serve a 6-county area: Fort Bend, Austin, Waller, Wharton, Matagorda, and Colorado counties. And we contract with the state to provide these services. It's general revenue funds, it's Medicaid funds, Medicare funds, and other funds that we earn that support the services that we provide. The Behavioral Health Division primarily provides outpatient services, and those outpatient services are provided at one of our clinics. The 2 clinics in Fort Bend County, one is located off of Airport Avenue, the other off of Cordes Drive in Sugar Land. Those are our 2 largest clinics. And we serve approximately 7,900, 8,000 people a year in our behavioral healthcare services. So there are a lot of folks that don't know what we do. The way that you access our services is a couple of different ways. You can call one of those clinics directly. We do have a website, which is texanacenter.com, and you can get the location of all of our outpatient clinics, and you can call the clinic directly to access services. A lot of folks access our services when they're in crisis. So one of the services that we do provide for the community is a 24/7, 365 crisis hotline. And that phone number is 1-800-633-5686. That is the mental health crises hotline. So when someone is experiencing a mental health crisis, that is the phone number that's called to access our 24/7, 365 crisis services. That phone number can be called by a friend who may be with someone who is threatening to harm themselves or others, and they don't know where to turn. That number could be called. They can also give you information about our clinic locations if it's not an emergent situation, but you're just not sure where you should go. So that is a very important number and one of our primary points of access. But we also, as I said earlier, access is through our outpatient clinics as well. So we provide, under the state's guidance and under our contract with them, we provide services under the Texas Resilience and Recovery model of service delivery. So what that means is that when you come to see us, you come in for an intake, an eligibility appointment, and we assess you. We assess you using a uniform assessment that the state requires, and then we also have to formulate a diagnosis. So you're seeing a licensed professional counselor up front when you come in for intake, and they're formulating the diagnosis and completing the uniform assessment to determine if you're eligible for our services. So we primarily provide services to the most serious and persistently mentally ill. So that's primarily schizophrenia, bipolar disorder, and major depression. We do serve other diagnoses if there is a high identified needs. So basically, you have to not be able to function in society and be at that point in order to receive our services and have them funded by the state. If you have another funding source, Medicaid or a Medicaid managed care plan, we can serve you. We accept traditional Medicare, not Medicare Advantage plans. We just don't have the capacity to serve everyone and have the responsibility to be the safety net provider. So we follow those guidelines from the state. We serve children starting at age 4 all the way up. With children, once again, we're serving the seriously emotionally disturbed children. If a child is at risk of being removed from home or removed from school, we're going to be able to serve them. We serve a lot of children with other diagnoses, ADHD, conduct disorder, basically serious emotional disturbance. So the diagnosis spectrum is a little bit broader when it comes to children and adolescents that we can serve. So that's how you come into services. You either in crisis, and if you're in crisis and it's emergent, that hotline is going to dispatch a member of our mobile crisis outreach team. We're going to meet you in the community where you are, if it is safe for us to do so. If you are threatening to harm yourself and you have a gun, we're going to ask for help from law enforcement because we are not equipped to remove weapons or guns. We can't detain anyone. We're there to help you try to work through the crisis. So there are times when we do need help from law enforcement. We're fortunate to have mental health deputies in most of our counties, and we have the crisis intervention team here in Fort Bend County. So we work very closely together. So you mentioned earlier that we work with Oak Bend. Yes, we do. We are in your emergency rooms quite a bit. We are screening those folks that have no other means to go to a psychiatric hospitalization, and we are arranging for that further evaluation at a psych hospital if it is needed. We are available to help if you have insurance. We still will come and screen, but then we would be trying to link you with a hospital that accepts your insurance. So we are here to help. If it's emergent and we're called, we're going to be there. We have written grants for funding for inpatient psychiatric beds. That's not an area that we're required to provide. A lot of people think it is, but really isn't. But we go above and beyond and write grants to get money to be able to hospitalize individuals in community psychiatric hospitals. So we contract with our local West Park Springs Hospital, as well as 8 other psychiatric hospitals in the Houston area. We also work with the state hospital system. Unfortunately, the state hospital is pretty much full with the forensic population, so it's extremely difficult to get someone into the state hospital system, and that's why HHSC actually had this money set aside legislatively for inpatient beds, and we wrote the grant, received those funds for our counties because it is needed, and we know that. So that's kind of the process when you're accessing through crisis services. If you're not emergent, they're going to have you call the clinic closest to where you live, and then we'll go through that intake eligibility process. And if you meet the eligibility criteria, then we're going to provide a level of care that's assigned to you and the services in that level of care. So those services include not just a prescriber, a psychiatrist or a nurse practitioner, but case management, skills training, psychosocial rehab. We are here to help you with whatever those needs may be. If you need help getting a job, we have supported employment services. If you need help with housing, we have supported housing services. If you're dealing with substance use issues, we're not currently a substance use provider. We are going to be working on a license for that, but we will help refer you. We will help get you to those services that you need. If you have medical issues, we're also going to help you with that. So we truly are here to try to help individuals with whatever their needs may be to the best of our ability with the resources available in our communities. If you are eligible for our services, we also provide medications. We have an internal, what we call our internal pharmacy. It's actually located in pharmacy in Wharton, our pharmacy is, but we provide medications to you at no charge, pretty much, or based on your maximum ability to pay. So that's how what your part that you pay works. We're not a free service, but it's based on your maximum ability to pay. It's a formula that the state prescribes that we follow. You could have a zero maximum ability to pay. So it's based on your income, your family, your dependents, or you could have a low maximum ability to pay, like $40 a month, based on your family, dependents, and such. So it's all a formula that we work. We don't refuse anyone based on their inability to pay. So we work with you on that. You're expected to pay based on your ability, and then we work through that. So a large number of the folks that we serve do have a zero maximum ability to pay. So all the services they receive, including medications, they receive and don't pay anything. Or, as I mentioned, they may pay a low. They may pay $40, $50, $60 a month for everything that they receive from us.
So you're a nonprofit organization, correct?
We are what's considered a governmental entity. We're a local mental health authority. There are 39 in the state of Texas, so every county is linked with a local mental health authority. We are linked with those 6 counties I mentioned before, and we are also a 501c3 not-for-profit. So we contract with the state, but we also, it's not enough money, as you all know. There's gaps in the system everywhere, so we do fundraise, we do write for other grants to get other funding, to meet other needs, and to try to fill other gaps in our community that we're not funded for.
So the community plays a big part in the support of mental health and the support of Texana. What are ways that we can get involved and we can help support this program? Because it's definitely something that's needed. And it's always better when community unites and understands the services you offer, but yet how they can support the services you offer also.
Yes, I think it is very important. I think for the broad community, I think one of the first things when it comes to mental health is you've got to be able to take care of your own mental health. And you've got to be able to talk about it and squash the stigma associated with it. Mental illness is an illness, just like any other illness that you all treat there at Oak Bend. It's no different. But unfortunately, mental illness does carry a stigma. We've made progress on that, but it's still not where we talk as mental illness like we talk about cancer. We need to get to that point. We need to understand that it is an illness, and we need to speak comfortably about it. We need to talk to those that we recognize may be dealing with signs or symptoms of mental illness and ask questions. When it comes to things like suicide, you've got to be able to ask that question, to ask your friend, your loved one, are you thinking about killing yourself? And if so, be able to reach out for the professional help that Texana offers. Mental Health First Aid is a program that we have rolled out, in particular, mostly with LCISD, with the school district. But we'd like to see more people in the community get trained in terms of mental health first aid. Because just as you on the medical side know and understand first aid and what to do if somebody's having a heart attack, or you learn CPR, there is mental health first aid as well. And we do teach that. We do have a mental health first coordinator here. It is an 8-hour course. It is curriculum based. It's a copyrighted process that we follow, but it is the gold standard for teaching about mental illness. And so we would welcome anyone who's interested in taking a mental health first aid course to reach out to our mental health first aid coordinator and work on that. If you have a group that wants to receive it, we can work on arranging that. So that's the first thing. Recognize mental illness. Don't be afraid to talk about it. Take care of yourself, especially during COVID right now with all the stress that we're under. You know, sometimes just being a good friend and socially connecting with people like we're doing right now over the phone, over FaceTime, even when we can't do it face-to-face, is so important to people, especially those people who may be struggling with depression and they're lonely. The isolation exacerbates some mental illness. So be the best friend you can be. Reach out, you know, look in your contacts in your phone. Text or call somebody that maybe you haven't spoken to in months. Let them know you care about them. Ask them how they're doing. And you can kind of assess over the phone how someone's doing and kind of know if maybe they encourage them to get some help, or maybe it's to the point where they're really, really struggling and you need to reach out for help for them. Don't be afraid to do that. You know, I know people are afraid to reach out. They don't want to get in other people's business, and they don't want their friends getting mad at them. But I always like to say, would you rather have a dead friend or a mad friend? You can repair a friendship, but if you don't do anything because you're afraid they're going to be mad and something happens, that's really difficult to live with. So I say reach out, refer people to Texana. We're here to help. We want to help. We don't have the funding to do everything. So when you hear about funding opportunities, support our county judge and our commissioners when they're trying to identify additional funding for Texana. Recognize how important that is. We haven't done fundraising recently due to COVID, but we do that as well. Support that. That would be my best advice on how the community can help.
You know, you talked about the stigma and getting through the stigma. Taking the mental health first aid course seems like a real good start to understanding and giving back, because we are seeing so many people having mental health and behavioral health issues, but yet COVID also has added a level of depression onto things for those that have been in their homes. So I encourage people to help Texana and support them that way. Their fundraisers are absolutely wonderful, and it's a great way to help support the community by supporting Texana. Is there anything else you'd like to tell us?
I just want to say thank you for the opportunity to share more. You know, I talked specifically about mental health, but we do so much more at Texana, as you mentioned earlier. So, and if you're willing to talk to other folks here at Texana, I would just encourage folks to stay tuned to learn more about all the services that Texana provides, because we are a very, very big part of the community, and we are all here to serve you in whatever way we can.
We'll also be posting their website, and I encourage you to go to their website because it is amazing. I think we hear the names, we hear who Texana is, but we never stop to figure out what they do and bring to the community. They are a great asset for us. We want to help them thrive, and we want everybody to be not just physically healthy, but emotionally healthy. So, Sheena, I want to thank you for joining us today. And a big thank you to our listeners for tuning in. Beginning now, Set an intention and a relentless focus on living your life as the greatest person you can be in all situations. Please join us next week.
Thank you for joining us today on Oak Bend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.